there's a huge concern with the cuts, and not just with Medicaid, but also the marketplace cuts, because they're going to impact the marketplace plans. People who have Medicaid, make no mistake, 8.3 million people will lose coverage, and people will die. Cancer patients, diabetes, children, elder people will die because of these cuts. And then with the marketplace plans, what they will do is they will become more expensive and harder to reach. So what was a gap that we call Medicaid gap, right? So you had people who had Medicaid, and it's hard as heck to qualify for Medicaid in most states. And then you have people who can afford private insurance. You had this gap, and then all of a sudden this sort of bomb of the big bill was dropped into the gap, and now it's a crater. So now we have millions of people who Medicaid's going to be harder to get. Marketplace plans are going to be hard to get, and so people will be struggling to be able to afford nursing home care, child care, cancer screenings, diabetes, insulin, high blood pressure medication, anything that you can think of that you would use your healthcare. And that's the other thing too, with one of the things that we know for sure is that access to health insurance coverage is one of the greatest predictors of whether or not someone will survive cancer.